So, this gypsy girl, how do you know her?
She is the girlfriend of one of my long-time acquaintances. That's how.
Okay. And so she took the vaccine.
She took 3 shots, 2 Moderna and 1 Pfizer. After the second Moderna, she had all kinds of complaints, and then she thought Pfizer would be just fine, so she opted for the third one as the Pfizer. And that actually screwed up everything.
Okay. The Pfizer was the worst.
No, it doesn't matter. The three put together.
Yeah. And she developed vasculitis.
Not just vasculitis. Vasculitis was the main thing. Her main problem was excruciating pain in the legs because of the vasculitis. But she also had profuse diarrhea because the inner layer of the bowels also got destroyed because of this autoimmune status. So not just the blood vessels.
Yeah.
So she was having profuse diarrhea. By profuse diarrhea, I mean you eat and 5 minutes later you go and everything is out.
Oh my god.
And then about 2 weeks later you start bleeding too.
All right. Diarrhea is very dangerous.
Diarrhea is dangerous, and specifically when it is an autoimmune diarrhea, then it inadvertently always leads to the so-called leaky bowel syndrome. That means that the bowels don't hold the feces, but let it seep out into the abdominal cavity, and that causes at first a subclinical chronic abdominal inflammation, and later an acute one, and that usually kills the patient.
So vasculitis is incurable autoimmune disease that is restricts the vessels. So basically, it will choke the organs of blood.
No, it inflames the vessels.
Inflames
it does
them.
not choke. It does not clot. It inflames the vessels, and it's a chronic inflammation. And the biggest part of vasculitis is not the obstruction of blood flow to the specific organs. It's the pain.
It's the pain.
Yeah.
Okay. So then what happened? Your friend came to you for help.
He came to me and brought the girl and asked if there is anything that can be done, because they were going to various professors and hospitals, etc., etc. And everywhere she was told that there is basically no cure, but what she can do is steroids, and then after the steroids are no good anymore, that happens quite often or quite soon, then you have to go on to drugs that are used for chemotherapy.
Mm-hmm.
That is the end, because the chemotherapy drug will absolutely kill the immune system. Now, with autoimmune diseases, you have a primed up immune system that is working overdrive, and it's gone crazy.
Yeah.
Absolutely mental. So you can try damp it down by steroids and anti-inflammatory other drugs, which are basically useless. Or if that doesn't help anymore, then you can take the immune system apart totally, and then you basically produce a patient with AIDS. That is no immune system. Of course, there is no autoimmune disease then, but then there is no immune system. So then you will die of some kind of opportunistic infection.
Like a cold, common cold.
Like a common cold or whatever. Or food poisoning or
Anything at all.
anything.
And the expected life expectancy of a person with vasculitis is 10-20 years.
No, it was 10-20 years before the jab era. After the jab era, it's 2-3 years.
Okay.
So it basically changed the whole picture. Before the COVID era, we had a good knowledge how to approximate what will lead where, what syndrome will lead where, how much time we have, how much risk we have to take, how bad it is. It was all in the books, and it was a good trade knowledge of doctors. What will lead where? Now this is all gone.
Yeah.
Now we don't know anything. Nothing behaves the way it should behave as it is written in the textbooks. Everything is different. So the vasculitis now is 1.5 to 2 years life expectancy.
And you expected her to live probably 1.5 to 2 years?
Or less, yes.
Or less.
And I told her, and I told the boyfriend as well, and they understood it, and that's it.
So she came to you for help, and you gave her some homeopathic remedies?
Yes, in these cases, homeopathic remedy is very helpful because it is the fine-tuning of the therapeutic effect. And we never ever have a good diagnosis, and the perfect diagnosis is the heart of successful healing. So since we do not have a diagnosis, only a partial, cloudy, misty, foggy one, there is vasculitis because we can see that, but what kind of vasculitis, what intensity it has, what specifics it has, we don't know anything about it.
Yeah.
So what we can do is we take the body fluids, which is saliva, blood, and urine, and in that you have the vibration of the whole syndrome.
Yeah.
Exactly.
Yeah.
And we take these 3 body fluids, we don't analyze them, we don't want to know what's in there. What we do is we use the body fluids to make the remedy.
Yeah.
And actually we produce a remedy from the body fluid of the patient. And then you have the exact remedy which is needed. The perfect key into the lock.
Yeah. And you also gave her Contraccine.
And I also gave her Contraccine because I know that homeopathy in this case is not enough. It is very good as a complementary thing, but the basic remedy was the Contraccine.
Okay. And after she took Contraccine, you recommended, 1 or 2 drops a day?
I said to start with 1 drop. If she's okay the next day, then take 2 drops. If she gets sick, then stay on that number of drops, not fall back. Because usually when, like say, on 3 drops you get a downtime, then they stop immediately, and then 2, 3, 4, 5 days later, when it's a bit better, they don't start again. So I told her that she cannot do that because it's an extreme situation. What she can do is every day walk up 1 drop until she reaches 10. If anywhere she gets downtime, that is an exacerbation of the system and the healing crisis, then she should stay on that one and not go back.
Yeah.
Until you break through the barrier. And this is what she done. She had 1 big downtime on about 5 drops, and then she went up to 10, no problem, and she stayed on 10 drops.
And how long? So what happened? Was she healed or?
No. 2 weeks later she called and she said that the diarrhea is much better and the pain is much better, and she doesn't really know why. I said nobody knows why, keep on taking it. So in about 2 weeks she had a relief period, which relief period lasted 4 months, and on and off. Then it's a roller coaster kind of thing. One day a bit worse, one day a bit better, a bit worse, a bit better, but you never go back to that bad state which you started out from. And this is why you know that you are actually healing, but it's not a easy path. It's always uphill.
Uh-huh.
That's how it is.
So she's still sick?
No. She called 1.5 months prior to this, prior to day before yesterday, when she called the last time, and she said that she has got absolutely no symptoms.
No symptoms.
She feels absolutely healthy, and she went to for the usual checkup. I mean, blood work and all, and 90% of the markers which are characteristic to the overall condition that she had is gone, and about 10% of the characteristics are still there, but to a much milder degree.
Yeah.
And then day before yesterday, he called and said that that 10% is gone,
The 10%'s gone.
Everything's gone, and she's absolutely healthy according to her blood work, and absolutely healthy according to how she looks and how she feels, because there is no pain, there is no diarrhea. She's like before, the good old beautiful girl.
The medical establishment would call this impossible.
The medical establishment would say that they don't know and they have to investigate it further, and of course she would not go back anymore there, so there will be no more investigation. But let's drop this whole thing. This is bullshit. The medical establishment is a killer.
Yeah.
So let's not even talk about it or mention it, because that leads nowhere. It's been mentioned by many people to no avail, and I'm basically tired of wanting to appease the medical profession, so they will say that yes, they made a mistake. They will never do that.
Okay, thank you.
Oh, right.